agenda is something called Healthy Screen Habits Bingo. So this is just in keeping with our theme of looking at the impact of media on screens, on youth in our region. So I want to start by saying, I created this bingo, and as I was going through this, I was like, oh my God, I have such unhealthy habits. So there's a lot of things on here that you might be like, I've never seen this before, I don't do this thing, I will never do this thing. But this is what is out there in terms of what we look at for what are healthy screen times for grown-ups, as well as for youth. So I would like to invite you to stand up if you wish and are able, and to move around and to find someone who can say, this is true for me. This statement here is true for me. And if you get bingo, we have prizes. Over here. Oh, here. I brought, actually, no worries. That are in line with our focus on family dinner and eating together and social time. So I have wooden spoons, which I will not throw at you, I promise. But then there's also reusable bags, which my boss told me to throw at you if you get bingo. And I can also. So please stand up if you wish and are able, and find some people who can say, yes, this statement is true for me. Thank you so much. Thank you everyone for coming. So happy to have everyone here. Did you have any bingo wrap up, or did everyone get their prize? Did everyone get a prize who either got bingo or really needs a prize? Also, you can win prizes if you were like, I really need this. No, we're good? Okay, well you know where to come if that shifts during the day. I got this best. All right, and Rachel's out there together. So we would like to welcome everyone. We're so happy you're here. We would like to especially thank our hosts here at the library and
bent the rules a little bit to get us in early, so we really, really appreciate that. We wanted to thank any elected officials who are here. Do we have any elected officials or elected officials aides here? I think that Dave Sullivan might be joining us in a little bit.
I'm with his office. Naomi. Hi.
There we go.
Hi.
Dave's office. Thank you, Naomi, for being here. We also wanted to acknowledge any school folks. Oh yeah, that'd be great. Thank you. We wanted to acknowledge any school folks because on the registration we had more school people register than I think we've ever had. So raise your hand if you're from a school. Yay! Yay! And we might have some other people joining us. I know your schedules are tougher than many others. I also wanted to acknowledge my little sister who's here from Alaska. I think she's outside though, but we get a chance to talk with her. She's one of the prosecutors on the January 6th trial. Kind of interesting. One of the prosecutors. And just thank you all for being here. Oh yes, I wanted to also acknowledge all of our peer ambassadors. Would you raise your hand or stand up if you are a peer ambassador? Rachel's going to give us a land acknowledgement.
Well, but first I wanted to make one other acknowledgement, which is the name tag snafu. We apologize for the name tags not matching the sign-in sheet, and we appreciate all of your patience in making your own name tags. Oh, I have 5 minutes. Okay, I would like to take a moment to acknowledge that we are gathering today on stolen land. As most of you know, this land was traditionally shared by the Confederacy, the Narragansetts, the Nipmucs, the Wampanoag, and the Wabanaki people. So doing a territory acknowledgement is a way that we can insert an awareness of Indigenous presence and land rights in everyday life. We do not intend this as a token gesture. We are not doing anything if we acknowledge the injustices of the past without working to remove the injustices of the present. So, and we must feel this in our bodies and not just in our minds. We have a tremendous amount at stake as all of us live on this planet. So we are privileged in Franklin County to have several organizations in our region that focus on lifting up Indigenous culture and history, and we encourage you to check them out, the Ocotillo Cultural Center and the Nolambika Project. They both have websites, and they host many events. There's lots of information on their websites. We encourage you to become familiar with those. We also encourage you to do further reading, especially in the last couple of decades. There has been a lot of proliferation of nonfiction work on Indigenous history from an Indigenous perspective that counteracts a little bit of the colonialist perspective. So we encourage you to look at that. We also encourage you to read fiction. I often find that fiction holds more truth than supposed nonfiction, and there is plenty of fiction by Indigenous authors, and I would like to give a shout out to the Greenfield Library. Their next multi-generational book club is reading There by Tommy Orange. If you haven't read it yet, it's really fantastic. We also encourage you to check out other types of Indigenous media. There's a TV show called Let's Talk Native. You can look it up on letstalknative.com. You can also attend the Pecumtuck Homelands Festival, which takes place every year in Great Falls the first weekend in August. And you can also look up Native Twitter if you're on X, which used to be Twitter. I don't even really know how to use it, but there is #Native Twitter. I think I did that right, probably not. Other things that you can do are to support the Massachusetts Indigenous legislative agenda. Again, that you can find them on the web. There are 5 legislative priorities, and supporting those priorities are a way to ensure that Indigenous people have their voice in our society today. You can donate time or money to programs or organizations organizations that support Native communities or Native priorities. You can also divest. Avoid banks like Wells Fargo and Chase that violate Native treaty rights by bankrolling environmentally devastating fossil fuel developments. You can find out more at mightydeposits.com, which will give you information about what your bank might be doing. And I just checked out that website this morning, and I'm like, I'm going back there. I really want to find out what's going on. And you can also campaign and vote for Native candidates at all levels of government, local, state, and national. And again, advocate for policy and legislation that supports Native communities. I'm saying all of this to you because I feel like I have a lot of work to do. My goal is to be a good ancestor and to ensure that the people who come after me have an easier time. So I encourage you all to join me in that effort. Thank you.
We have a lot on our agenda. As you know, we are releasing the 2023 Student Health Survey data as well as the Community Action Plan, and want to have time for discussion and everything. So I'm going to turn it over to Nick Hathaway, is our evaluation coordinator, and he's only been with us for just over a year, so this is his second data release, and we're very, very, very honored to have him presenting the Student Health Survey data. Because we want to have time for discussion, what we're doing, we have at your tables some index cards, and if you can write any questions that you have on your index cards and maybe grab my attention or someone's attention, we can pick up those questions. We'll do some of these questions during the meeting. The rest of them we'll answer either while you're having discussion or after the meeting so that you can see the answers to them, but that'll give us time to actually have some table discussions. All right.
Great.
Thank you, Nick.
All right, thank you
Can
all.
everyone hear okay? Sorry. We can work on getting the mics fixed, but I think the acoustics are very good.
I know names.
The sound in the back, can you all hear me? All right, good. All right. So I'm Nick, thank you all for coming. I am evaluation coordinator for the Community Care Coalition. This is a presentation summarizing the results of our 2023 Student Health Survey. And before I get into content, I want to acknowledge that I will be discussing some topics that are sensitive, including suicidality, depression, and sexual assault. So we encourage you to do whatever makes sense for you to take care of yourself as you go through this evening. I'll be covering several topics here. First, I'll give provide some overview information on what the survey is and who takes it. Then I'll cover some briefer topics on substance use and sexual health and relationships, and then a slightly broader section on mental health and screen time. And for Q&A, just to keep things rolling, so we've got a tight agenda. If you have any questions that come up, please, we'd love to hear them. But if you could just jot them down on the note cards that you have at your table and get them to Tyler, one of us, and we'll circle back to it as soon as we can. And then we'll go into table discussions afterwards, which we'll give you more instruction on as we get there. So. This is our 21st year consecutively of collecting the Student Health Survey in Franklin County North Quabbin region. To date, since 2003, we've collected 35,000 Student Health Survey responses. Over 1,400 this year alone, which accounts for 3/4 of all 8th, 10th, and 12th grade students enrolled in all 9 public school districts in our region. This year, we used the Youth Risk Behavior Survey, or the YRBS, which we use every 3 years, and that runs in a cycle with 2 other survey instruments. And each one of those surveys covers a lot of the same common ground on substance use, mental health, and such, but they all have their own flavors of things they focus on, and the YRBS tends to focus more on risk-related behaviors and things that can lead to poor health for you. And of course, we customize each of those surveys for our own Franklin County North Quabbin interests and such. So this is a very ugly look at the demographics of our 2023 survey. But I just want to show that we tend to look at gender identity, race and ethnicity, sexual orientation, and socioeconomic status. I'll point out that for socioeconomic status, we currently use parental education level as a proxy for that, which is admittedly an imperfect proxy, but it correlates reasonably well for what we need it for at a high level. But I also want to note just the range of different identities that students identify with, and how important that is for us to be looking at and acknowledging. And with that, though, unfortunately, we do have to pool, because of small sample sizes, we do have to pool most of these identities together into these very high-level categories, or 2 or 3 responses. But that may not always be the case. We see just in the last 9 years showing here, we've seen that a lot of our samples are showing a lot more diversity in the students that we capture, and it's partly because of the way we're asking questions, we're learning better how to capture more of that diversity, but it's also because the world is getting more diverse. So there's a lot to that, and we acknowledge how important it is to keep on track of the changing norms and preferences around how people identify, and so we're committed to that and always interested in having those conversations if you have suggestions.
Could you talk slower, please? You're talking really fast, and you're flipping through the slides really fast.
Okay, just trying to stay on time
I
here.
understand that, but we're supposed to understand what you're
I got you,
presenting.
thank you.
Thank you.
So, moving into a section on substance use now, the general trend is that youth substance use is decreasing. And this is something we've been seeing for, that slide is formatted fine. This is something we've been seeing for a couple of decades now. This is supposed to be year on the x-axis, and the percent of students that are reporting recent substance use for each substance. And that's been going down for a couple of decades now, at least what we've been seeing, and then in 2021, we see that that substance use was at historic lows across all the substances that we look at. I'm so sorry, this isn't formatted. And we had a little pop-up here, and things are relaxing back down, but still generally lower than they were pre-pandemic, so that's some good news. This is supposed to be vaping here. This surged up in 2019, probably because of how it was being marketed and novelty around it, but has since relaxed a little bit. So still higher than cigarettes, which are down here and popped up just a little bit. And this green line should be cannabis. So I just want to also note that cannabis has, recent use of cannabis has decreased overall in those 2 decades, but less than, compared to alcohol. And now we've got this big divide here between students using alcohol and cannabis, and now they're about the same. So just a thing to note.
Does the vaping include the cannabis?
That's a very good question. I don't really want to get too far off track, but yeah, the way that we do look at this, it does wind up getting conflated with, so it's more of a method and not a substance. We do have data on that. I had to pull it out.
I'm not gonna keep interrupting.
No, we love feedback, so that's great. This is a graph just showing demographic disparities in all substance use across a students' lifetime. So it's a huge generality, I just want to point out. But so for each gray bar here, this represents the percent of students for that group that are reporting use of any substance that we track on our surveys anyway, across their students' lifetime. And so the dashed line shows the average for all students. So we can see which groups are a little bit more or less likely to be reporting any substance use. And so we see that cis girls and women, LGBTQ+ students, and lower socioeconomic students, status students are more likely to report substance use. Sorry about that. And right, so if we look at individual substances alone, we surely see nuances and differences, but these are the disparities that still stand out for all of those. Some good news though, some of the substances that we track, we are seeing big collapses of those disparities. So this is recent cigarette smoking, and so going from 2007 to 2023, for each one of these demographic dimensions, we see that where students were once far apart, and there were lots, so for example, a lot more LGBTQ+ students reporting recent smoking, that has just really collapsed. So on top of all students in general being less likely to use, those disparities would be collapsing. And that's not the case for all substances, but we have to note wins when we have them. Along the line of substance use, we also see impaired driving decreasing, and similar to recent use, where alcohol seems to have a lot more dramatic declines than cannabis, we see riding with drunk drivers and of those students that drive and driving decreasing more than cannabis. Tangentially, I'll also point out that we have an increase in reporting of texting driving. So 50% or nearly 50% of all students that drive are reporting texting driving. So summarizing substance use, we see in general that youth substance use and impaired driving are trending down. downward, and that cis girls and women and LGBTQ plus students and lower socioeconomic status students are more likely to report substance use, and that some of the greatest disparities in substance use, for example, cigarettes, smoking, are decreasing. Moving now into sexual health and relationship health. The general trends we're seeing are that sexual activity for students is decreasing, but we have some evidence of sexual and dating violence going up. So this is a graph showing just several different measures of sexual activity among youth. Things, were they were more sexually active around 2010, and then has since been decreasing. Most notably since 2019, which there was a big pandemic thing here that happened. So it might also be related to just the lack of the greater isolation of these students and the fewer opportunities for sexual activity. Concerningly, though, we have seen an uptick sharply since 2019 in reporting of sexual and dating violence. First, they all know that this graph is zoomed in from the other one, so it's a relatively small amount of students in the first place, but we do see this big increase. And this is of students that are dating, those that are forced into sexual intercourse, or physically hurt by their partner, or for all students forced into sex acts and such. And that has increased dramatically, or at least for this small amount of students. But I also want to note that this may not simply, this is self-report data, it's observational, and it may simply not necessarily reflect behaviors or experiences changing or becoming more common, but more common of reporting them. It reflects increases in education around consent and empowerment for reporting. Along those lines, if we look at for each of those lines, disparities within those, we see that LGBTQ plus students, as is combined gender identity and sexual orientation, are a lot more likely than cis heterosexual students to report sexual and dating violence, which again might just be reflecting differences in education around consent. Summarizing what we're seeing here, we see that youth sexual activity is generally coming downward, and that sexual and dating violence we have evidence is reporting of is increasing since 2019, and LGBTQ plus students are reporting sexual and dating violence more frequently. Now, moving into mental health and screen time. The trend is really that it's really complicated. The jury is still out on a lot of this, but we do, have some. We do have a general idea of what would be going on. So we're all pretty well aware that we're in a mental health crisis, and it possibly, we have some evidence that maybe it's starting to relax. Maybe we're past the peak. Now the kids are out of the pandemic, and those restrictions are lifted. But I also want to note that self-harm here is at a near historic high since the last time I measured in 2021, and that is non-suicidal self-injurious behavior. If we look at depression, these patterns hold up across all the metrics of mental health. If we look at, we see that it's cis girls and women, or just it's all the more marginalized, less privileged students that are more likely to be suffering or reporting mental health symptoms. The larger context of all of this is that of an increasingly digital, virtual world that we're all living in. So this is a graph showing a mix of our own local Franklin County data here and also national data from the Pew Research Center and Statistica, and it's showing, so these top three are showing increases in in ownership and access to smartphones, both for kids and adults. So kids here, this is the percent of students, over 70% in 2019 own a smartphone by age 13. And that's increased to now. But this here, this red line, is the percent of students in our own data that are reporting more than the recommended 2-hour maximum of daily recreational screen time per day. And that's, the majority of students are getting more than that. Several studies have covered, we all are, pretty well aware that there's a strong correlation, a strong positive relationship between the amount of daily recreational screen time that kids get and the percentage or the likelihood of them reporting mental health symptoms or mental health issues. But there is a lot of nuance within that. It's not just a simple linear relationship as this one suggests. So there are a few problems with it, and two that I'll point out here. One is that with too much screen time, you tend to get just a lot of displacement of otherwise enriching healthy activities that kids need, social development and things like that. And so you see that the more they get, the less sleep they get, the less activity they get. But again, it's not completely linear here. So this, with sleep, it actually suggests that maybe students that are too restricted and get no screen time might not be as well off as students that get just a little bit or a moderate amount of screen time. Similarly, another thing that is an issue with too much screen time is social comparison. As students are on screens more, especially if they're looking at a lot of social media, there's a lot of that, and their brains are early primed for that, so they're potentially vulnerable. And we see here that with students that are getting too much screen time way over here, they're having increases in anorexic and bulimic behaviors and trying to lose weight. But also similarly, we have this nonlinear relationship where students that are getting none or very little may not be better off than students that are getting moderate amount. Another thing that we've been looking at is decreases or changes in the amount or the students feeling a connection to adults at home and school, which is a big protective factor for substance use and mental health, and certainly I guess for maybe even for screen time. But so we've seen a dip in the proportion of students that are reporting that they feel like they have a adult at home that they can talk to about important things. And similarly at school, fewer students are reporting that they have an adult at school that they can talk about problems. And again, this whole pandemic thing that kind of probably affects that. So if we look at that, how that relates to things like social media, we see that students that are reporting not having or not being sure that they have an adult at home to talk to are a lot more likely to report that they are checking their social media hourly or more. So it's really important for us to not put the onus entirely on parents, and it's easy to do that. But a lot of this might in fact come down to things that are out of parents' control. So for example, if we look at the proportion of students that are checking social media frequently, we see that higher socioeconomic students are checking less frequently, and they're having dinner and that opportunity for connection with adults a lot more often.
Could you slow down again? You're swallowing your words.
Thank you.
Thank you.
Appreciate the feedback of that. So, okay, so the point here is that more students that are more privileged are likely, if we entirely put the onus on parents, we're doing a big disservice to less privileged kids. And again, the relationship between the amount of social media, or the amount of screen time that students are getting and the likelihood of reporting mental health symptoms is not entirely straightforward. So for example, the relationship between screen time and anxiety, as we saw earlier, was linear, and we see that we have this very increasing relationship for cis kids, but when we look at gender diverse kids, that linear relationship goes out the window. And what this may be reflecting is that a lot of more marginalized students may rely on social media or other forms of screen time to connect with their peers that they otherwise wouldn't be able to in real life or IRL. So if I can try to summarize this, we're seeing that mental health and screen time are strongly correlated. We're seeing dramatic increases in both. Two of the problems I've outlined here are displacement of healthy activities and excessive social comparison, and that some screen
Olivia. I am a peer ambassador with the CTC and Stacy at the Brick House. My kids are not quite old enough for phones yet, but my oldest is currently moving in that direction, so I have been wanting to start her with using the Bark phone. I had a Bumblebee as a child, but they no longer exist. It limits access to social media and text. They cannot delete any texts. You can set time limits on the phone and lock them out of their phone if ever need be, if there's an unsafe situation where you can still call them, but they cannot utilize the rest of the phone. There are alerts for inappropriate language or content that you can set. Totally understand that my kids will be using the internet and texting and calling. It's, normal thing of life, but I would like to try to make it as safe as possible for them to be able to use, being age appropriate.
So we'd love to know about your own feedback about that when we get to table discussions, but the next one is about media contracts.
Hola, mi nombre es Heidi Martínez, soy parte del grupo de Peer Ambassador, pertenezco al Family Center y estamos aquí para hablarle acerca de los contratos para darle un celular a tus niños. Antes de yo darle un celular a mis niños, cogí una clase, un webinar, acerca de muchas ideas que nos dan, acerca de las reglas que puedes darle a tus hijos. Para mí, para que mis hijos tuvieran un celular, pues yo escogí que tuvieran que hacer sus tareas, tener buenas notas en la escuela, tener buen comportamiento en su escuela y yo poder chequear su teléfono cuando yo quisiera verificarlo. También los sigo en sus redes sociales y eso para mí ha funcionado mucho con respecto a las reglas con su celular.
Okay, so we'll next go to a video from Derek Morrison, principal of GHS.
So hi, Derek Morrison, principal of Greenfield High School. We are in our second year of Yonder implementation, so Yonder cell phone pouches are now policy at Greenfield Middle School and High School. Why we're using Yonder pouches is to eliminate some of the distraction, eliminate a lot of the social media aspects where students were really having difficulty separating themselves from that at school. First year was challenging, for sure. Giving the kids their pouches, allowing them to keep them on their property, their personal property on them, I think is huge. Our second year in, we've been able to see much more compliance, acceptance, students understanding that this is what we do here. What it's yielded for us having Yonder here at school is a more engaged learning atmosphere where students are engaged in classrooms more, and that social interaction piece, which is so important for students at this age. For them to go to lunch, for them to be able to sit with their friends and kind of interact, laugh, have fun. And I think in our crazy busy world that we have, where things work and move so fast, students need that.
And that's certainly a big topic to talk about. So there are lots of sides of that argument.
A partisan group of U.S. senators are reviving a bill that would require safety features on social media. The Kids Online Safety Act would make companies including Meta, Google, and Twitter responsible for making sure the internet is safe for children. The companies would be required to monitor and act against harmful content related to bullying, eating disorders, and substance abuse. The bill also calls for time-based restrictions and privacy features for users under the age of 17. Under the proposal, the FTC and states' attorneys general would sue companies that don't comply.
The one in the next video are, systemic changes that are in support.
Data, their personal information is the raw material that big tech uses push toxic content that harms children, that harms teenagers. We have to address this straight on. Today, the committee took an historic bipartisan step towards stopping big tech's targeting, tracking, and traumatizing of the young people of this country every single day. We are sending a loud message to big tech that enough is enough. Enough prioritizing money over mental health. Enough prioritizing profits over people. Enough prioritizing growth and business over young people in this country. It is time for Congress to meet this moment and to act with the urgency that these issues demand.
So yeah, I guess we'll cover this one next. But if you would like to provide some anonymous feedback, discussion, we'll keep this up and we'll share this. You can scan that into a form you could provide.
Great. And actually, I am going to go back one slide to this last one because you just saw 5 different videos of like resources and solutions, but we also have lots and lots of resources. This is actually a new resources page on the Communities That Care website that we recently launched, and you can find, where is it, Growing Up Online, you know, all these resources about growing up online, as well as all these other resources for parents and school staff and people who work with youth. And this new draft of the 2024 Youth Resource Card. If you're on the Franklin County Resource Network list, you know that we've been revising this. So here it is. Take a final look before we put it into current form, but also it's very valuable to have in the online form. So, but Nick, thank you very much for all of that information. We do know that that was a fast overview. Nick has developed like 70 slides and charts and stuff in the paring down to this, you know, because we took out the things that had really important main points. But all of those slides, we're making all of this available on our website after today. So there's more information there that you can look at, and we are so available to come to your school, to your staff meeting, to sit down with you in a meeting, go through the data in more detail. It's all available online. We needed to give you a brief overview, but we want to make ourselves available for more information at any point. We have 21 years of data. This region has better data than any place else in Massachusetts, and probably most places in the country. And we want to make this available to you as possible. Nick can make slides that are specific to your needs as well, whether you're writing a grant or planning a program or just wanting to get a handle around what your young people are up to. So thank you for that. I'm going to read some of the questions and offer them to Nick. I'm starting with the ones that are actually not questions for Nick, but questions to pass back at the group. Because as you know, this is survey data. We don't get in-depth lots of information. I want you all to think about this and give us the information and give it back to each other because we don't know the answers to these ones. Here are some of these questions. Any sense of why students are still less likely to report being able to talk about problems with an adult at school? That's an important question that we as a community want to answer and think about. Here's another one. Why might LGBTQ+ students be experiencing or reporting harm or force in sexual relationships more than non-LGBTQ students? And another person added to that question, do we know whether the harm in that LGBTQ students are experiencing in relationships is coming from same-sex partnerships or from opposite-sex partnerships, or do we know the context? And the answer is no, and we might be able to find out more.
We have some limited data on that. We might be able to parse that out.
Okay.
Yeah, but it's a good question. It's worth looking at.
So if you want to look at the limited data that we have, talk to Nick, and but otherwise I think it's something we might need to dig into more. Here's another question I don't think we have the answer to. Are youth having reasonable reactions to the violence they experience and witness online? Okay, so we know that witnessing things online can have, even though you know, it's not happening right in front of you, it can have some of the same trauma effects on people, young people and adults, you know, as witnessing it in person. So that's a good question. Here's another one. How do we define a crisis and who determines the crisis? Based on what norm? So let's see, and are we tracking strengths rather than problems? And what's the context of these behaviors? So again, our survey, not only do we want to make it available to you in terms of bringing the data back to you, but also we always ask for input in our survey design. We're always trying to balance using the nationally validated surveys that we can then use to compare to ourselves to the rest of the country, as well as balancing using old questions so that we can compare now to the past, with the challenge of also keeping up to date and not like using old language or being stale. So we're always trying to balance that, but we always appreciate your input, and the Regional School Health Task Force is the group that sets the survey finally. So there are more great questions. Let me ask one that's a Nick question. How do you report cisgender? How is that determined?
So we have this year and in previous years we've asked about we've asked a separate question of whether students are identified as transgender, and if they don't, then we can assume it's cisgender. And this year we used a different format where we used a multiple checkbox option, and cisgender was an option, transgender was an option, and there were students could click as many as apply.
Great, thank you. Here's another one for you, Nick. If non-Hispanic white is white, how are Hispanic white people counted?
Hispanic white people, and as just convention of how we've done it over the years, is grouped in with people of color.
So why don't you just call white people then?
Wanted to make that distinction that Hispanic white people were being put in the people of color. Does that make sense?
No, because, no, it doesn't. Because the assumption is, Latino people, if you're not white, then you're in the people of color category.
But I think many Latino people would identify as Latino and white. And so that's the...
But then if they identify as white, then they're white people.
Right, but if they identify as both, and this is the problem with trying to put people in categories. We know that people don't actually come in categories, and Cheryl has shared some really very important articles with all of us about the
Lie of race.
The lie of race, and you know, the fact that race is not a biological category, and we know this, and that's really important to acknowledge in this. And at the same time, there are some social realities of how our racist society treats race, and so we want to acknowledge that we're looking at this as a social category, and it is a problem to have to lump people into groups, but it is our best way of looking at what disparities there are and showing that we have a long way to come to overcome racism. So,
White supremacy.
White supremacy and white dominant culture.
If I may add to that, just by convention, we've been analyzing them as mutually exclusive groups, but going forward, my plan is to, since we're using a checkbox format and it's not a multiple choice, we can analyze each group non-exclusively.
So, thank you. I think the rest of these questions we will do our best to, we'll answer them in a Google document so that people can look, and this will be shared with the notes. But we want to give you time to discuss the data, what you've seen. We shared these videos at the end because we know we don't want to be the harbingers of doom all the time. We want to be thinking about solutions and what we can do about all of this. So our prompt questions, which are on your agenda, if I may steal yours for a second, Jesse, thank you. Our prompt questions, which you do not need to stick with, but is to encourage a little bit of positive solution thinking, are you familiar with any of the resources or policy initiatives that we shared? What do you think about them? And do you have other ideas or resources that you can share? And we asked if some folks might be able to bring laptops. If you would like, if you are so inclined at your table to take notes, either in the Google document that you get to if you scan this with your phone. Not everyone needs to do this. Maximum one person per table. To scan this and go to a Google document and take notes for your table. But also, if you'd like to just take notes by hand, or if your table doesn't want to take notes, we'd like to hear some of your feedback, and so that's one of the ways that we can get your feedback is if you take notes in the Google document or on a piece of paper, and we'll take it up later. But what we would like is for you to sit with your tables, or if you have a small table, you can turn to one of the other tables that has a small group, and think about those questions or anything else that comes up for you, the questions that the unanswered questions that I just asked, and process the data. Yeah, Phoebe?
I scanned the Google Doc, and how do I know what color I am, or do I just pick one?
That's a good question. You could pick one. Why don't we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And if one table turns to the other, use the number of the table. And you can use that to take your notes in there, okay? And we have 10 minutes for this, which means we're exactly on time. Yeah, I'd like to invite you to turn and act. Oh, great. Calling us back together, and want to do a quick synthesis. My plan had originally been for synthesizing that I would go into that Google document and read some key points from each color, but I didn't see enough laptops open to think that that's going to be probably the best way to do it. So I'm going to call on a few tables who want to share a main point from your discussion, or a main question, or a main, theme. Anybody want to say something from their table discussion, something that came up? Yeah, Ellie.
I have a question about data in relation to friends and teen relationships. So one of the things we're seeing at the CEC and just trending in general is people non-consensually sharing or forced sharing of nude or sexually explicit imagery in relationship and out of, and I don't know if that's yet included in looking at harm, sexual harm.
Good question. Really good question. Does everyone know Kelly from the Children's Advocacy Center? And Jen Trent over here from the Children's Advocacy Center? And Abby Bliss, thank you. And obviously they're really important partners in this. As we saw in the data, we need to get a handle on this. And let's talk about getting those questions into the survey. Our survey tool is 3 different surveys in a 3-year rotation. So we have sometimes questions that are rotate in and out, but especially when we see something spiking, then we want to make sure that we're asking about that the next year and getting more data. But that's a really good point, that question about nudes and online pornography and texting and all of that. So
we do have a question about that this year that asks about whether students have been shown sexually explicit images on their cell phone, so I can get you that information.
And it's a remarkable number of students who say that they've been shown sexually explicit images at school not against their will, without their consent. Yeah, about a third of students are saying that.
There is I just want to throw in Massachusetts legislation pending around that, so if that's a concern that you have about it being dressed appropriately, contact your legislature.
Thank you.
It's good, it's a good law that they want to enact.
And does everyone know Becky Lockwood from the Salison Center? Also another important person to know. And Jen Oddly is telling me the time is up.
And hard job today.
And just okay, I'm not going to ask for one more thing because time's up. But the next thing that we have on the agenda does give you more time to discuss, especially solutions-based. we are now in front of everyone's at the table is the new version of the Community Action Plan. As many of you know, if you've been around for a long time, the Communities That Care Coalition has kept a Community Action Plan for, these are all the old versions, since 2004, I think was the first one we came out with. Actually, I can tell you, 2005 was the first one we came out with. We started in 2003, but it takes quite a while to make an action plan because there are a lot of voices reflected in this action plan. And what I want to do right now is show you a few highlights of changes in this year's action plan. So here is the action plan. If you go to page, it says 34, but I know there are not 34 pages in here, so that can't be right. If you go inside to page 2, you will see what did I want to highlight here? Oh, that since the coalition's inception, this collaboration and the action plan has helped to mobilize more than $12 million throughout the community towards youth development strategies in the community action plan. So hooray for that. And along with that, I wanted to make sure, I think everyone here maybe has heard that we recently got a large federal grant called Strategic Prevention Framework, SPF grant, that's going to allow us to do more youth leadership and prevention. So that is the next step that's coming. It's going to fund our survey going forward with more youth engagement. It's going to fund a little more policy work, and it's going to fund youth engagement and prevention. So that, I wanted to bring your attention to that. On the next page, our vision, mission, and values, the coordinating council has updated this. Can you raise your hand if you're on the coordinating council? All right, there's lots of hands up, fantastic, thank you, coordinating council members. We have added a set of values here, and somehow this is not lining up quite, but we put more of an emphasis here in our approach on lived experience and community input and engagement. Moving forward, I wanted to bring your attention to this page, what is it? It's not page 36. Page 5, the characteristics of white supremacy culture. If you have not read this information from Tana Kun, it's very highly recommended. And I also wanted to bring your attention to this article that our coalition authored in the Stanford Social Innovation Review that describes a little bit about what our coalition has been working on. Next up, on page 6, I wanted to bring your attention, we have a new work group. It's not brand new now, but it's new since the last action plan update. The Community Supports for Young People work group. And we have Megan and Risha are the 2 work group co-chairs for that group. Hooray!
And Jennifer Webster co-chaired with me the first year.
Yes, and Jennifer Webster, former co-chair, and Jen Oddly, staff assistant and CHIP coordinator. It's a collaborative work group with the CHIP, the Community Health Improvement Plan. And also, the Policy and Norms work group is now the Regional Policy and Norms work group. One of the small silver linings of the pandemic was that it was easier to collaborate across counties, and this Policy and Norms work is much better shared, so we're now collaborating across Western Massachusetts on that work. Next step, I wanted to bring your attention, we did not make any changes. We discussed and reviewed our priority risk factors. This is our community's priority risk factor for reducing youth substance use and improving youth mental health. We didn't make any changes to the actual measurements, but what we did was we changed the way that we're talking about them to make it a little bit more positive and a little bit less jargony. This is in your action plan now. New resources that I already mentioned, but I really want to make sure that you're aware of. This youth resource card that we've had for a long time, but now it's online. We have some video tours of agencies that our peer ambassadors have made of some of their host sites and other places, and we'd love to make more. And then we have this website that has resources for parents, adults who work with youth, and youth themselves, sorted by category. And we really hope that you take a look and bookmark this and use it. It's not exhaustive. Our point was to make it not exhaustive, but to make it curated, some of our favorite things. But if you have favorite resources that you'd like to see on there, please let us know. And the last thing I would like to say is what makes this coalition powerful and important is all of you, all of the agencies and individuals that are involved. We have many, many, many different agencies involved, and this plan is a collaboration with all of these different work groups coming up with all of this different, putting in all the different input, and we could not do any of it without you. And it's always evolving. From the minute we create a plan, it's already out of date, which is fine. It's time to update all the time. Each of the work groups has done what we call the bullseyes, and in the center of the bullseye are the core strategies of the work group. These are the things that the work group has said, we're working on this, we're coming together to work on this. On the outside are things that, these things are happening in the community, and we really want to support them where they're happening. So they're allied strategies, they're allied with the goals of the work group. And so each work group, they have their goals, their membership, and their core strategies and their allied strategies. And what we're about to do is I'm going to put one of these on each. We're going to do youth, the community sports for young people here, then parents back there, parent and family engagement work group, racial justice right there in the middle, and then we'll do the policy and norms work group here, and the regional school health task force. So school, youth, parents, and policy, and racial justice, okay? And what we're going to do is we're going to split up, and you're going to go to the table. The work group chairs are going to stay at their table, and they're going to be able to answer your questions, show you the highlights of what has changed. The things that are circled are key things that have changed since the last action plan. And they're going to answer your questions, tell you about what the work group is doing. You can sign up to be added to a work group email list by signing up on one of these. So this is going to be a little bit, yay. This is going to be a little bit rowdy for a minute, or not rowdy.
Loud.
Chaotic. Movementful. Yeah, it's exciting, loud, chaotic. And, but then once you get to your table, try to get so that quiet enough that people can hear the work group chairs talking about the work group, okay? So if you're a work group chair, come stand up and go to your table. They're the only ones that actually need to know which table it is because everyone else is going to rotate. So you'll get a couple minutes at each one. Sorry to have to pull you all together again. I know that was short. I told you we're cramming in a lot. But it is time for us to call in a vote to approve the next action plan. If folks feel ready to have a vote to approve the action plan, which has been approved by each of the work groups as they did their things, and also has been approved by the coordinating council. But we really would love to see if the whole coalition is ready to approve the plan. Is that, how do we do this? Someone call for a vote or something?
Someone has to move it and second it.
All right, someone want to move? Make a movement? Make a movement, yes. I do the same thing. Okay, I heard a move, and I heard a second. All those in favor of the 2024 Community Action Plan approve it? Aye. Any abstentions? Any opposed? All right, we have a new action plan. As I said, it is out of date already, and that is fine. We take all the input all the time. Or we give the award to Amy and Dan. There are two people here that deserve a really, really, really special call out. If any of you picked up a copy copy of this when you came in. This is the parent guide, a 20-page insert in the Recorder and the Apple Daily News that we've been doing since 2007. And for about 13 of those years, that has been coordinated by Stacy Langnett over there. Hey, Stacy! They worked on this together, and it's absolutely amazing. And I have two, but one walked somewhere. So they're for you to share, and we'll find the other one. Thank you, Stacey and Jenna. Jenna, and then Rachel is going to, hello Jenna, thank you for everything. Rachel is going to present the award to the fabulous, unstoppable, amazing Amy.
I'm going to read a speech and get you thoroughly embarrassed. So, as most of you know, because we've been doing this for 20 years, the Communities That Care Coalitions has two awards that travel around, and in the fall is when we present the Community Builder Award in honor of one of our founders, Mike Fritz. This award goes to a community member who demonstrates vision and leadership in promoting the goals of the Communities That Care Coalition in the community. This past year, the award has been with Musica Franklin, whose leadership team, Vicki Citron, Gloria Matlock, and Oris Jenkins, was awarded the Mike Fritz Award last year. And I don't think any of them are here today, but I do have a picture of them holding the award, and so they will get this picture. And because they had to give the award back. I do want to mention, since she is here, one of our award winners, Cheryl Dukes. Cheryl's initiative to get the box that holds the award, so now it's even cooler. So this year we are delighted to be giving the award to Amy Merceverde. Amy opened Merceverde, a fine burrito bar, I hope you've all been there, located in downtown Greenfield over 20 years ago. In fact, a few days after I started my job here. So we were kind of on the same timeline. Before that, she worked at Greenfield's Market and then served as the People's Pint's first cook. At Mesa Verde, diners can find fresh, delicious food, including meat and veggie options, and dishes to accommodate all food needs without sacrificing taste, as well as excellent beverages. I'm doing an ad here. What diners also find there is community, which is priceless. It is a friendly, bustling place with indoor and outdoor seating, fun music, and bright colors. It's a place where diners run into people they know or talk to people they just met. Just a show of hands, how many people have had that experience at Mesa Verde, seeing either people, oh my God, okay, so that tells you something. Amy has worked consciously to build this community at Mesa Verde and beyond. She has hosted events to support new entrepreneurs pitching their ideas. She has supported the work of local artists. She has proposed and raised funds for a community video screening of I'm Not Racist, Am I?, produced by her friend Andre Robert Lee and hosted by the Communities That Care Coalition. She has given sermons as a guest worship leader at All Souls Church. And that's just the beginning, not to mention all the work she did to feed people during the pandemic. Yeah. She makes an effort to know everyone and to make people feel welcome. I can attest to that. One of her most recent endeavors has been to team up with the Haitian immigrant community that has been in Greenfield for the past few months. Amy met one of the community members who ran a small business in Haiti and who worked as a chef in Chile before coming here, and realized that one way to make the Haitian community feel more welcome in Greenfield was for them to be able to share their food from home with each other and with the broader community. Amy offered Mesa Verde's kitchen to a group of 4 cooks from the community on Sunday evenings, and they cooked several Haitian dishes for the collaborative pop-up restaurant. Volunteers help serve the food and tend the register. Proceeds from the pop-up support the Haitian community's needs. And as you can see, I have the poster for the Haitian pop-up on the back of my cheat sheet, and you're welcome to look at it. The energy Amy puts into building community is contagious, and she sets a standard of caring about people as individuals and as a whole community, and putting her heart into everything she does. As Kirsten Levitt, another Mike Fritz awardee, once said of Amy, Amy is always looking out, always striving to be better, always with a creative idea. Please join me in congratulating Amy.
Struggle, which I was one of, in addiction to help people, and I sort of vanquished my addiction to alcohol here, got a bank loan right next door, gave sermons, sit on the board over there. I don't know how many places we would live where, a young half Chinese, born in Vietnam, queer person could come here and be honored like this, but in so many ways. So I hope you'll go and extend it with to Masmi, who walked here from Chile and made most of the food that you're about to have for lunch. It takes 3 months to walk from Chile to the border, and we're just so lucky to have these members join our community who are so excited to be amongst us, to cook and join us. So I think that it was really meaningful when Governor Healy gave a press conference and said Greenfield was the place that was the most welcoming out of the 300 plus municipalities. Woohoo!
Thank you so much, Amy. We are so pleased to honor you. Here's the Cheryl Dukes case. Thank you.
Well, if Cheryl made the case, then I'm going to have to put some bling on it.
I didn't, so I just want to be clear, I did not make the case. I paid for the case. And actually, was a local person in Buckland who is a fine woodworker, made the case. I could not afford what he would have charged for it because he didn't tell me. And so I'm gonna cry. To Amy's point, this is a magical place to live, Franklin County, right? I mean, look around the room, right? Magical. I asked for the case because I actually, traveling, took it everywhere with me for the year that I had it. To have pictures taken with people in community, because I was the first person from the University of Massachusetts Amherst, from which I am now terminated, who received the award, because the award was given to people in community. I was the first person who lived in community, who brought community to the University of Massachusetts Amherst. Because I wanted to sit in the university as us, to bring what we do to that place that we pay for, but is really hard to get into. It's now harder because I'm not there anymore. And so this is a perfect opportunity for me to say to all of us, it is up to us to invite them into our space, to show the people who create these social constructs how we do what we do by living together with each other. Because they're cognitive, disembodied, and what we are whole people living in and with community together. Now I'm
So, the plan for lunch for but what we've done is we've set up lunch, thank you, over on the other side so that you can head out, get your lunch. Please don't stay on the other side because that room we have to be out of by 1. There's another meeting happening in there. But you can take your lunch and either bring it back in here or sit outside. If you sit outside, we encourage you to sit with people from the meeting or anyone else in community, but that's our point is to serve lunch so that people will stick around and have the important relationship building conversations time that we all get here. That is
Just one thing, we are composting everything from the meal, so you will see some green compostable bags. If you happen to have something with you that is not compostable, please don't throw it in there, but all of our plates, cutlery, food, cups are compostable, so throw them in there, and the Montague transfer station will receive it all tomorrow.
also, we've been taking photos throughout the meeting. I'm sorry I didn't ask this in the beginning. If you would like to make sure that your photo doesn't go anywhere public or something like that, and GCTV is also here filming from the back, if you would like to come talk to me and we will take any photos that have you out of what goes up on websites or that sort of thing. So, thank you. Any last thing before we split for lunch? Phoebe,
stand up. Okay. So, hi, I'm Phoebe Walker. This is on your table. This is a very important survey that the Massachusetts Department of Public Health does every 2 years to find out what the needs are of people across Massachusetts. We really need them to know what the needs of rural Franklin County are. And last time we did this survey, it resulted in tens of thousands of dollars coming back here to be invested in programs that many of you know about, but just didn't know that this is why it came here. So please, 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 it closes on Halloween. So if you haven't filled it out, fill it out. If you could share it with anyone, a neighbor, a relative, that would be great, a young adult. Thank you very much.
And one last thing, we had, go ahead and then I'll do, Karen or Stacey, really quick.
I just wanted to say there are pumpkins outside for you to take. They are courtesy of the Atlas Farm Store, the Opioid Task Force. I don't want to carry them back to the truck. So please take a bag, take some stickers, share it with the folks you work with, share it with your families, but please take them.
Thank you, Karen. Thanks for giving those. And Stacey?
Jenna.
So, Parent Family Engagement Work Group recently has collaborated with Lasagna Love, which is an organization that was built here on our soil, trying to help families, well, whether they need food or not, just to build a community. And we're looking for volunteers throughout our community to help build Lasagna Love. And we're collaborating with them in hopes around the holiday season. So the more volunteers to bring food to families, the better.
There's 2 flyers here. One is you can actually go online and request that a lasagna get delivered to a local family. Or you can also volunteer to be one of those cooks to make a lasagna to deliver to a local family. So we're putting an emphasis with the organization on, like, that crazy time in December when, you're thinking ahead of what's for the holiday meals, but you can't think about how to feed your family right now, that kind of stuff. So families, as we know, are busy and, all that kind of stuff. So there's flyers here. Thank you.
Thank you. And we have one last thing, which is we invite you, when you're sitting at lunch, if you're sitting with folks you do or don't know, an icebreaker we had asked, we've been trying to think, maybe there's like a Haitian icebreaker that we could do, and we asked a couple of our coalition members. We did not come up with a good Haitian song to teach you or anything like that, but Matt had the great idea that perhaps at your tables, maybe you could share a cultural practice, something from your culture, a practice that you do that's meaningful to you. So we invite you to do that at your lunch tables and share that with us. So thank you very much.